Dr. Mukherji, tell us something about Crystal Wellness Center.
The Crystal Wellness Center came about because I have felt that in today's very stressful times, we need to look into mental well-being. As a psychiatrist, I have always been only dealing with mentally ill patients, depressed patients, anxious people, people who are very stressed out. And I feel that the time has come when some preventive action needs to take place. I have felt that very young children are also very stressed because of the way they are handled or rather mishandled, and so the problem starts shortly after birth, and it carries on as long as a person is alive. So at every stage there are a unique set of problems which need to be dealt with, and if somebody is aware of what one should do in order to prevent this stress from getting really out of hand, that person is going to be able to lead a much more fulfilling life, can avoid physical and mental disease. This center was set up as a trust. Well, it was actually decided that a trust will be formed. And
how many such centers are there?
There are 2 centers.
Which are the places where you have centers?
There is one center in Godiahat, near Godiahat, which is Crystal Clinic, which I have been running since 1998. It deals mainly with psychiatric problems. In the last 14 to 15 years, I realized that the time has come when more work needs to be done, and that is when I felt that the wellness center should come about. A trust was formed called the Mukherji Charitable Trust, and both the clinics are part of this trust, and it is hoped that a lot of other outreach programs can also be conducted through the trust.
So you said that there are essentially 2 clinics that you are running now under this trust. One is at Godiahat, the other is at Godia.
Yes.
But tell me something, the name of the trust is Mukherji Charitable Trust. Any particular reason for the name that you have given for the trust?
Dibyendu is my father's name, and Jyoti means halo, and I think it is combined the 2 and the trust was formed. It was formed with the managing director and chairman of Brainware, Mr. Mukherji, who has been in the education business for a very long time. But he felt that there was a huge need for such a center, and that is why this trust was formed.
Tell me something very briefly. What are the kind of services you are offering there? We are calling it a wellness center. It is not strictly a center for illness.
No.
So you have very deliberately made a distinction between illness and wellness.
Yes.
Now, besides treating illness, what are the other aspects that you treat, and what is the portfolio?
Okay.
What is the basket of?
Basically, I have tried to bring in other aspects of dealing with stress or with illness. Actually, a very rich traditional healing methods were present. Things like yoga, meditation, and other traditional means, which I felt also added to one's well-being. I personally feel that these have a huge role to play, and actually the Indians taught the world yoga and meditation, and I think that any kind of physical and mental illness and well-being can be helped through yoga meditation. So this is one of the things that we have included in the wellness center. It looks at initially we thought of just a beginner's course where there will be classes to keep mentally and physically fit. Then yoga and meditation have a role for people who have got some diseases like arthritis ulcers, hypertension, diabetes, etc. The illnesses that are these days being called as lifestyle diseases, and they are greatly helped through this. Then we have packages such as parenting skills training, where a person who has certain confusion in bringing up a child can attend these parenting classes. These parenting classes can be are divided into 3 groups, that is absolutely young children, then school-going children, adolescents to young adults. So there are these classes are attended by parents because they are not very sure as to how to deal with the various kind of problems, normal problems that one faces at these age brackets. Then we have specific parenting groups such as ADHD parenting classes, etc., which is again getting into a bit of specialization, but often parents have reported that this has helped them enormously because they get to know the illness better, and often just by making changes in the way they handle their offsprings makes a lot of difference, and it prevents them from going further downhill or from developing complicated mental or physical illness.
How does one go about fixing an appointment there? What is the procedure?
One can actually, we prefer them to go directly to the clinic and make an appointment, which is done. We have introduced a software, so it is a computerized sort of appointment system these days. People who live outside Calcutta can ring up and make an appointment at the telephone numbers that are specifically given for making these appointments, and eventually we expect that for a small percentage of patients or clients can make an appointment online.
There is a very strong team that you have developed over these past few months for the trust. Now, could you tell us something about your team members?
Okay. Right now, we are dealing with the mental well-being aspect. We have been concentrating on the mental well-being. So we have some very good experienced psychiatrists, psychologists. Then we have a very good special education team where because we find that there are a lot of children who come to us with academic problems. As you realize that staying in India, especially in Calcutta, one of the major concerns for most parents is their child's academic performance, and for this there is a lot of anxiety, there's a lot of pressure put on the child. There are schools are often unfriendly and they often do not recognize what is causing the child to not be able to perform. So for all these, to deal with all these aspects, we have special educators, and they deal with all kinds of learning disorders or dyslexics, attention problems, memory problems, etc. So that's another team that we have. Apart from that, we have career counselors, we have speech therapists, and of course, as I mentioned, I previously mentioned groups. There's a lot of group work that is going on with various age groups. We have social skills training, we have concentration building groups, and just teenagers attending us who can sort of be taught life skills. For example, there is a lot of confusion amongst teenagers about their careers, their relationships, their interactions with their parents, their peers, etc. So this is another area that we sort of try to deal with through groups. There are a lot of groups that are in the pipeline, but since we are very new, we haven't been able to really start them, and a lot of people are not even aware that such a center exists. But once I think people get to know that such packages are facilities are provided, I think there will be better response from people around.
You were just mentioning before we started the interview that you were also planning to involve doctors from other disciplines.
Yes.
Because wellness does not necessarily mean that it has to be mental wellness. There is a question of physical well-being.
Absolutely.
Now, something about that. What kind of professionals do you want to include in this trust?
I think one of the very important factors, first of all, is that there's a link between the mind and the body. So you cannot, if there is somebody who has some kind of a lifestyle disease or any kind of physical illness, then that person is going to be mentally stressed out, and vice versa. So I feel that that there should be a sort of involvement of all major disciplines in this wellness clinic, because it is only then can we really look into the preventive aspect of any kind of illness, both physical as well as mental. I would be wanting to involve people in medicine, in cardiology, in pediatrics, in neurology, in I would also like other stuff like dietitians, nutritionists, because I think they have a huge role to play. The other important factor is that psychiatry is still something that a vast majority of doctors, and when I talk about doctors, I talk about doctors treating patients in the main discipline. They often are not that aware of what is going on in the mind, because that is something that has never been really even much importance in the medical curriculum. But most doctors will admit that it is a sufficiently important branch, and they get a lot of patients who come to them who need help. A lot of the times the treatment is more easily accepted. Even psychiatric help is better accepted from other specialties. For example, a cardiologist or a gastroenterologist, if somebody goes to them and they prescribe the same medication that a psychiatrist prescribes, a patient is more willing to take that. So I think that the whole approach has to be in a very holistic fashion, and we need to involve other disciplines, and that is something that I plan to do in the next few months, that is get them to be working in the same center.
So if they were to contact you,
yes,
would they be talking to you over the telephone that is indicated at the bottom of the screen, or you would like to ask them to ring up on your personal phone? How do they contact in case they are looking at this program and they want to contact you?
You mean the doctors?
I mean the doctors, or
they should contact me directly. They should contact me directly, and because I think they need to know what the whole what this clinic is about, this wellness clinic, what is it about, what are the services that we are already providing. I think this is something that they need to know, and the other thing that is also very important, that I do not see this clinic as a polyclinic where people just come, they see their patients and they go away, and they do not know what other kind of things are happening in the clinic. I think every consultant who works there has to be very clear about what are the things that we are doing, and what are the things that they might have ideas to give us, which might further enhance our services. For example, I know that there are cardiologists or there are pediatricians who would also like to run groups, educational groups, because for example, there's still a lot of confusion about a lot of illnesses, and in a group setting, if a doctor comes and gives a 1 hour sort of a workshop on the do's and don'ts of a particular, what are the principles that one need to follow in sort of treating this patient, or the lifestyle that one needs to adopt. it is far better accepted in a group than when you're doing it individually. So there may be a lot of enthusiastic doctors who might add to these groups, and ultimately we can have something that is quite unique and quite different, certainly something very new and novel in this city.
There could be a number of other groups or other occupational categories who would be very, very interested in this kind of service. For example, as you were telling me about the kind of function, kind of services that you are offering, I thought of for example, the headmistresses or the headmasters of various schools. I also thought of the principals of various colleges, because they are dealing with a very very volatile group in terms of the age, because they are teenagers. So it includes general colleges and engineering colleges. I suppose the NGOs will also be very, very interested. Would you like to, over and above the kind of people that I have mentioned, would you like to add a few more who could benefit, and I mean, whether there could be a synergistic relationship between you and the group?
Absolutely. I think you are absolutely right, the mistresses and the headmasters and the professors in colleges. I think that first of all, teachers have to be very careful about their behavior and how they deal with students these days, because they're constantly in the media and there are problems which are being highlighted, and they are, I think, by and large a very stressed out group, and they would benefit from packages or groups where they could come and, if not anything else, ventilate about their problems. I think that there are people from all walks of life could benefit from these groups. For example, the corporates. There's in the executive class, there's a huge lot of pressure, deadlines to meet. They have very long working hours. They have often end up using, they either smoke or drink because they feel that's the only way to cope with their stress levels. They often end up having serious marital problems because of the stress that they carry home, which leads to another vast sort of variety of problems. So I think by and large, even the corporates would benefit from that. A lot of very big corporate houses these days have their inbuilt stress management programs, or they have people coming over to do stress management programs. Now, I feel that while that is something that happens every 6 months, what happens to people in between? I think we are providing services where somebody who is aware that or feels that he or she is getting stressed can just walk in and enroll in such a group, because this is going to be going on throughout the year. So I think then there are people also, I find another group of very stressed out people are those who work in the glamour industry. Now, I don't know how much they would be willing to come and be part of a group, but a lot of them are again under serious pressure to perform, to be in the limelight, etc. Then there's another specific group, that is those who work in the BPOs. There's a very high level of stress in these youngsters because they have access to money, and they are probably have not reached the maturity levels to handle the complications involved in handling that amount of money. Often they just waste the money and they get into a huge financial problems because they have several credit cards which they're using, and then they suddenly realize that they're into financial problems, they're into relationship problems, they are into drugs or into all kinds of very maladaptive coping skills. So that's another area that I feel would hugely benefit from this kind of participation in workshops or year-long groups, etc.
Tell me something, have you also considered the possibility of reaching out to various schools and colleges, in the sense that if head of the institution wants you or a member of your team, of your choice, to go and address the students, because it is not always possible for all of them to come, and so I think some kind of a outreaching program is also necessary.
That is very...
Do you have that in mind?
Yes,
also?
we do have that in mind. We have a pretty large team. In fact, there are 1 or 2 people in the team who do a lot of outreach programs, and they have joined our team because they feel that a lot of things can be done by going directly to the corporate houses or to the schools and colleges and conducting programs in a much larger scale. And then it would also, after attending those programs, people would then have the option of coming, some of them at least might feel that they would either need further help as attending individually for maybe psychological help or psychiatric help, or visiting any other consultant, any other discipline, or they could be attending one of our groups. So that is definitely on the cards, having outreach program. It's definitely on the cards.
I have 2 more questions to ask you. The first is not directly connected with the connected with psychiatry per se, but it has a link. As I understand, you are perhaps the first woman MRCPsych who started practicing in Kolkata. Am I right?
Yes, in a way you're right. There have been people who are much senior to me. There are 1 or 2 women who have got the MRCPsych, but in those days one was awarded the MRCPsych degree. They didn't go through the kind of academic program that I had to go through in my times. So technically speaking, you could say that yes, I'm probably one of the first MRCPsychs.
Okay, taking it from that, since you have also practiced abroad,
yes,
in the UK for quite some time, when you first came to Calcutta, I'm sure you had also faced problems of mental blockages where a patient would hesitate to wait in a psychiatrist's chamber.
Yes.
In the last 10 or 15 years that you have been practicing here, have you noticed any significant change in the way people have started looking at psychiatry?
Well, I would like to say something here. I took up psychiatry because I felt that I would have a lot of time to do other things. I have a lot of other hobbies and interests, which I thought that psychiatry, taking up psychiatry as a profession would allow me to do those things. All that I can say right now in answer to your question is that I do not have time for those things anymore. I have a 2 to 3 month waiting period to get my appointment in one of the clinics. That would not have been possible if people continued to have those mental blocks. I am not saying that the majority have removed those mental blocks, but a significant group of people have, which is why more and more people do go to psychiatrists. They are not ashamed to see me on the street and say, oh, she's my doctor, or they will, if they see me on a television program, they will call everybody and say, or they will ring up people and say, my doctor is on television. So they can do this only because they feel that it is all right to be going to a psychiatrist. Secondly, coming back to your question, that there used to be people who would not be wanting to be seen in the waiting room in case they met somebody else they met who would then know that that oh, she's going to a psychiatrist or he's going to a psychiatrist. I think that has reduced, except for celebrities or well-known faces who want to remain who do not want to get into a room where a lot of people are going to sort of give them a lot of attention. I think most people do not have this hang-up anymore, at least the kind of people that I see in my practice. Secondly, I think I have to attribute this change to the role that the media has played. In the last 10 or 15 years, media has certainly done a lot about this. There are regular programs on television, there are regular articles in the newspapers, in the magazines, which talk about mental illness, which talk about various psychological issues, problems, and I think it has certainly educated the people a lot, which is why they are less hesitant to go to a psychiatrist these days compared to what happened maybe 15-20 years ago. Secondly, the schools and colleges, well, certainly schools and corporate houses, they have psychologists, they have counselors in their, either they have corporate, sort of industrial psychologists working in corporate houses, and schools have counselors. So they too identify children or clients who require psychiatric help. So the overall, I think the picture is certainly changing. And I think that we are, in a way, we are looking at, we have taken something positively from the West, where going to a shrink was, in fact, almost fashionable. One would rather go to a shrink or a psychiatrist or psychologist rather than go to their physician, because they feel that they need to have their issues dealt with. So I think that is happening here in India.
Okay, my final question to you would be, where do you see Crystal Wellness Clinic, say 2 years down the line? What are your wish list? What is your wish list, or what are your plans? Where do you see this going?
Well, 2 years down the road, I would hope that people are much more aware that such a center exists. Very importantly, I would like to hope that we have been able to achieve to some extent this concept of wanting to be well and preventing illness. I would like to hope that at least even in a small population of clients and doctors, there is a unity in the thought processes, and one doesn't work sort of in exclusion, but one works together amongst the medical profession, which is also quite a, I would consider that to be quite a remarkable change in the mindset of professionals. So far, it has been that you have a physical problem, so you go to a physician. If the physician thinks that there's a mental problem, then there is almost sort of, you do not have a physical problem. Henceforth, your entire medical care is going to be done by the psychiatrist. Now, my point is, everybody has both a mind and a body, and there is a link, and we need to work together. And in order to be able to do that, I think doctors too should develop this attitude that they take somebody who has mental problems, his or her physical problems are also taken seriously. The reason why I make this point, or I emphasize this point so strongly, is that if there is somebody who has been going to a psychiatrist, develops a pain in the stomach, then 9 out of 10 doctors say that it's psychological. At a much later stage, it is found out that this person has been having a serious physical illness. The doctor has not taken this person's problem seriously because according to this doctor, everything is mental, simply because this person has gone to a psychiatrist. Coming back to your question as to what do I
How you
see
would like to see
in 2 years' time?
Yeah. Where would you like to see?
Yes, I would hope that that there is a lot of acceptance by people, by professionals of the kind of work that we are doing, and I would like to expand further, and I would hope that the stigma of mental illness is further reduced, quality of life in those who come to us and to those who we go for outreach programs can truly feel that we are making a difference in their lives. When that happens, then I believe that there is going to be a demand for more of such centers, and hopefully we continue to grow and expand.
Thank you, Dr. Mukherji. It has been an excellent interview. It was a learning experience as well. Thank you very much.